Hello viewers, welcome to my channel. Today we will talk about usefulness of CyberKnife therapy in differentiated thyroid cancer with distant metastasis. Why on earth are we even talking about this? This is because this very question was asked in 2023 in one of the university MSc ENT theory exams. In today's video I will discuss what is CyberKnife, what is it used for, when was it developed, various aspects that make CyberKnife more suitable for certain applications than other technologies. Then we will discuss briefly what are differentiated thyroid cancers, and finally we will discuss the different sites where distant metastasis can happen in cases of differentiated thyroid cancer. Finally we will be able to tie it all up in an answer where we will talk about how CyberKnife therapy can help in treatment of distant metastasis happening in cases of differentiated thyroid cancer. Also, at the very end of the video, I will share something which I hope will explain why this question was even asked in the first place. So stay tuned. So I have a problem with describing what is CyberKnife. CyberKnife is a proprietary technology, and this video is not sponsored by the maker of CyberKnife. CyberKnife was developed by an American company based out of Sunnyvale, California. CyberKnife is basically a technology which helps in providing stereotactic radiosurgery treatment to patients. Now, what is stereotactic radiosurgery? It's important to understand that radiosurgery and radiotherapy is not the same thing. Radiotherapy involves fractionated doses of radiation, whereas radiosurgery uses large doses of radiation to introduce tissue ablation. That is, it is a form of surgery where tissue is removed for simplicity's sake by using large doses of ionizing radiation. Of course, just by mentioning this, you can understand that using large doses of radiation will have significant side effects. So, a technique has to be developed to focus these large doses of radiation only on the part of the body that needs to be removed. In other words, malignant tissue. You don't want large doses of radiation to be reaching other parts of the body and producing undesirable side effects. That's where the word stereotactic comes in. Stereotactic is basically referring to a three-dimensional coordinate system where only the target area, that is the tissue of concern, that is the malignant tissue, is exposed to ionizing radiation. So just to repeat, CyberKnife therapy is a method of introducing high-dose radiation to destroy malignant tissue in a targeted manner. So CyberKnife therapy is stereotactic radiosurgery. When was it developed? It was developed in the late 1980s in Stanford University, California. The clinical trials started in the 90s, and if my history knowledge is correct, then in 1999 CyberKnife received US FDA clearance for clinical use for intracranial lesions, and in 2001 it received clearance for use in treatment of malignant lesions in other parts of the body. This is an important distinction. CyberKnife is the technique of stereotactic radiosurgery which can be used for lesions all over the body. The other similar sounding technique, that is gamma knife, is very different. Gamma knife is so far only restricted for use in intracranial lesions and very limited cervical spine lesions. So don't make the mistake of thinking that gamma knife and CyberKnife are the same thing. In fact, on your screen you'll be able to see the various differences between gamma knife and CyberKnife. So if you can't recall CyberKnife, don't make the mistake of describing gamma knife when you're writing the answer. They are very different entities. CyberKnife includes three important components: a lightweight linear accelerator, a robotic delivery system, and a non-invasive image guidance system. It's very important to understand where the radiation dose should be directed. To understand this, we need images. These images are obtained by CT and MRI, and a target area is determined. The target volume of the tumor is determined, and usually the radiations are provided to this area with a margin of 1.2 to 2 mm diameter. This is how targeted radiation is provided to the body to destroy these areas of pathological tissue. Okay, So this is the description of what is CyberKnife, when was it developed, and how is it better than other techniques of stereotactic radiosurgery. Now we will move on to differentiated thyroid cancer. If my explanation of CyberKnife therapy created more confusion than was already there, feel free to reach out to me in the comment section below. I'll be happy to explain myself further. Also, if you notice any inaccuracies, then also don't hesitate to mention it in the comment section below. I'd love to learn from you. Moving on to differentiated thyroid cancer, as per the American Thyroid Association, differentiated thyroid cancer is only two things: papillary thyroid cancer and follicular thyroid cancer, which constitute more than 90% of all different types of thyroid cancer. However, if you want a bigger answer, because real estate in terms of the answer is of importance when you're writing a theory answer, then you can write that follicular cells of the thyroid tissue lead to thyroid cancer of the follicular type as well as thyroid cancer of the papillary type, whereas parafollicular cells lead to medullary cancer of thyroid. There is undifferentiated cancer, which is also known as anaplastic cancer. There is also lymphoma of the thyroid gland. However, as per ATA guidelines, American Thyroid Association, differentiated thyroid cancer refers only to papillary thyroid cancer and follicular thyroid cancer. Now, papillary thyroid cancer is largely associated with lymphatic route of spread in terms of metastasis, whereas follicular thyroid cancer has blood-borne metastasis, where metastasis can happen even in distant tissue like bone, especially bone of the vertebral column, brain, as well as lungs. Let's move on to distant metastasis. So now that we know what are differentiated thyroid cancer and we know what is CyberKnife therapy, let's discuss the last piece of the puzzle. Where can distant metastasis happen? Distant metastasis can happen in brain, in bones, in lungs, especially in follicular cancer of thyroid. Papillary cancer of thyroid largely is associated with lymphatic spread, so it is largely associated with cervical lymph nodal metastasis. Now, what happens when a patient with differentiated thyroid cancer presents with distant metastasis? This patient will require treatment. As an ENT specialist, you need to know what are the different treatment options that you can offer to this patient. What are they? Earlier, radioiodine therapy was used, external beam radiotherapy was used, but these were found to be not so effective. Why were they not effective? Because it just did not produce the results that were desired. CyberKnife therapy has been used where desired results have been obtained. It has been observed that CyberKnife therapy is useful, not just in terms of reducing the growth potential, but also in providing therapeutic effect by producing internal necrosis, especially in cervical lymph nodal metastasis. So a study was done in Japan, and that is probably the raison d'etre of this question. You will see on the screen the screenshot showing the first page of the study. This study was conducted in Japan, which talked about the usefulness of CyberKnife therapy in treatment of differentiated thyroid cancer with distant metastasis. It was observed in the study that in all the patients who received CyberKnife therapy, a good result was obtained, not just in terms of reducing the growth potential of the lesions, but that is, the lesions stopped growing after receiving CyberKnife therapy. Some lesions even underwent internal necrosis. I believe the cervical lymph node metastatic lesions. I'll leave a link to the entire article in the description below, and this will help you answer this question really, really well. So, just to sum up, CyberKnife therapy is a method of administering stereotactic radiosurgery to patients where large doses of ionizing radiation is required to achieve therapeutic or good treatment outcomes where metastasis has happened in a case of malignancy. Now, CyberKnife is not just for malignancy with metastasis, it can even be used for benign lesions, but for this particular situation where there is distant metastasis in a case of differentiated thyroid cancer, the only possible treatment option that has showed promising results is CyberKnife therapy. That is probably why this question was asked, and it might sound a bit harsh that questions are lifted from recently published articles, but this is how it is. there are sections of the exam which talk about recent advances, and as ENT specialists you have to keep abreast with the advancements that are taking place in therapeutic technology. I hope you like this video. If you have any questions, if you need me to answer these questions in the old format where I wrote down the answers and I basically read from my own answer, then I can always switch back to it. This was an attempt at making a different kind of video. If you like this one, please mention it. If you want me to go back to the earlier version, I'll be happy to do that as well. Take care, bye bye, and please don't forget to be awesome.